for joining on short notice. Without further ado, I would like to turn over to Miss Elizabeth Riley, the Acting Executive Director of CDEMA, to make some brief comments. And then after that, we will open up for a few questions. Over to you, Liz.
Thank you and good afternoon, Andrea. And I really want to express thanks to the members of the media for joining this afternoon's press conference. I want to start by expressing our sincere solidarity with the government and people of St. Vincent and the Grenadines at this very challenging time. As you know, we do live in a region which is faced by multiple hazards, and certainly the events that have unfolded since December of 2020 have really reiterated this for St. Vincent and the Grenadines, where we have a coincidence of the COVID-19 pandemic, which of course is affecting all of us. What started as an effusive eruption of the Soufriere volcano, and of course in a few short weeks, we will also be facing the 2021 hurricane season. And I want to reiterate the message of resilience as I present in today's session. As you know, the work of the coordinating unit is very heavily guided by the science. And as such, throughout this event, we have depended very heavily on our colleagues at the Seismic Research Center of the University of the West Indies. And we want to recognize the sterling contribution and the robust advice that they have provided to the government of St. Vincent and the Grenadines throughout this event. As you're aware, this morning at approximately 8:41 a.m., Soufriere did transition from an effusive to an explosive eruption. I want to speak with respect to the status on the ground as reported at 1 p.m. today. We are advised that most persons have been evacuated from the red zone, which is also known as the very high risk zone to the impacts of volcanic eruption. And we are also advised that visibility did hinder some of the evacuation efforts today. At this time, there are 62 shelters occupied by 2,318 evacuees. There are also a number of other shelters, approximately 8, which have been activated but are at this time unoccupied. If you're familiar with the geography of St. Vincent and the Grenadines and you have been tracking the event, there were 2 communities which the authorities in St. Vincent and the Grenadines had identified as being of concern within the orange zone on the southwestern flank of the volcano. Those are Chateaubelair and Fitzhughes. And I'm happy to indicate that reports are that those 2 communities have been evacuated at this time. The evacuation for those 2 communities took place through a combination of land evacuation and also utilization of marine assets last evening into night. And over 600 persons were moved through the use of the marine assets. We're also aware that there's at this time an undisclosed number of self-evacuees who went to stay with friends and families, and the government of St. Vincent and the Grenadines is quantifying those numbers. The Ministry of Health in St. Vincent and the Grenadines has also initiated the process of PCR testing and vaccination of persons in shelter. And this is also a message which has been continuously shared by the authorities in St. Vincent and the Grenadines as we went through the planning processes. As you can appreciate, the needs list for the country is being revised in light of the very dynamic situation on the ground. And we anticipate having an updated needs list sometime in the near future. So I want now to speak a little bit to what the CDEMA coordinating unit has been doing to support St. Vincent and the Grenadines during this event. As you know, we play a supporting role, and we directly provide assistance to the national disaster offices and once activated through the emergency operations centers. I also want to at this time recognize the excellent work being undertaken by the CDEMA coordinating unit team. And the team has been working continuously since late December when we went to an effusive event. So guided by the science, we had activated our regional coordination plan and the regional coordination center in December of 2020, on December 29th. And at that time, and continuing throughout the period, we maintained very close contact and in close discussions with the authorities in St. Vincent and the Grenadines. In accordance with our regional coordination plan, we placed on standby a series of surge support teams for St. Vincent and the Grenadines in the event that those were required. And those teams covered areas of rapid needs assessment, damage assessment and coordination, operational support for the Emergency Operations Center, the Caribbean Disaster Relief Unit, which is co-coordinated with the Regional Security System, as well as our regional urban search and rescue team. So these have all been on alert since December, late December of 2020. In addition, we have provided a range of technical support to the National Disaster Office as per their requests. And this has included planning support in the areas of evacuation and logistics. We supported in the strengthening of the Volcano Hazard Emergency Annex to the National Disaster Plan, looking at detailing standard operating procedures for a number of the functions to be executed under that plan. We also have been undertaking testing on the side of emergency telecommunications frequently every week since we moved to the orange level alert. In addition, we have been supporting with respect to pre-impact data analysis, including the use of our GeoCris, which is our geospatial platform to allow for supporting decision-making. And in this instance, we've been using it for informing information related to humanitarian actions. There have also been 2 exercises conducted in support of the efforts to prepare for what has happened today. Those took place in late January as well as in late March. On March the 1st, we also deployed a member of our CARICOM operational support team, the COST, and that person, Superintendent Sylvan McIntyre out of Grenada, who is one of the stalwarts of the CDEMA system with extensive deployment experience. He has provided direct support to the EOC in St. Vincent and the Grenadines since March 1. And in fact, he's still on the ground providing support through this transition to the explosive event. And we really want to thank the government of Grenada for allowing us to have access to his expertise, and to Superintendent McIntyre himself for the sterling contribution that he has been making. We will also be dispatching another operational support member to St. Vincent and the Grenadines. This is a part of the plan that we had worked through with them. And that person will be Captain Robert Harewood, and we're working through the details of his deployment as we speak. Other areas of support have been with respect to coordination, and this is very important for systems readiness and to allow us to be most effective in supporting states through the matching of needs which have been identified by the impacted state with the offers or pledges which are made by our regional as well as our international partners. And this coordination has been undertaken through 2 key groups. The Core Coordination Group for Volcanic Hazards, which is a a small core group which works directly with St. Vincent and Grenadines through the entire preparedness process, and now working directly in terms of the support to country, and also through the Caribbean Development Partner Group. This is co-chaired by CDEMA's executive director and the UN resident coordinator for whichever geographical jurisdiction is impacted, in this case, the resident coordinator from Barbados. And both of these groups have been meeting since January, working through the preparatory actions, discussing needs, matching pledges and financial resources with needs identified. And in fact, this afternoon at 2 p.m., we have a meeting of the Caribbean Development Partners Group, where we will be discussing the existing needs in St. Vincent and the Grenadines as things have changed over time. And this morning, we also had a meeting of the co-coordination group. We've also worked on resource mobilization. And in doing so, we have mobilized to date approximately 300,000 US. And I want to express thanks to the development partners who have been excellent in their support to the work that we've been doing. Financial contributions were received from USAID, UK Foreign and Commonwealth Development Office, the UK FCDO, the government of Romania through Romania Aid Agency. And I also want to recognize the contributions through Global Affairs Canada, which provides significant financing for technical human resources within the coordinating unit who have been working on this emergency, as well as the French military installation in Martinique, which has been very supportive, including providing helicopter airlift to the Seismic Research Center team in doing their work. More recently, over yesterday and today and into tomorrow, we are also working on the positioning of priority relief items. We're dispatching approximately 1,300 cots from our sub-regional warehouses. Those are located Antigua, Barbados, and Trinidad and Tobago. We do have a fourth warehouse in Jamaica, but we haven't called upon the resources within that warehouse as yet because of course, geographical proximity is guiding us at this time. We've also had generous donations of cots from some entities, including the Barbados Defense Force. And I want to thank Colonel Glenn Granham, the Chief of Staff, as well as a donation from CARICOM Impacts. And I want to thank their Executive Director, Lieutenant Colonel Mike Jones, who supported us in those efforts. I also want to recognize the entities who have been working very closely with us in facilitating the logistics of the positioning of these items, the regional security system through their executive director and the excellent team at the Air Wing, who we can always count on for the regional response mechanism, the Department of Emergency Management, Ms. Hines and her team, the Barbados Defense Force I mentioned already, but I also want to recognize the other regional institutions who have been working very closely with us in these efforts. CARFA, the Caribbean Institute for Meteorology and Hydrology, and on the political side, the OECS Commission and the CARICOM Secretariat, who have provided sterling support in helping us to make those political connections and to support the efforts that we have been making. So I thank you. This is the conclusion of my statement, and I am happy to take any questions at this time.
Go ahead, Jay, with your question.
Hi, good afternoon. German Abel from SK Advanced Syndicates and Navies. Just to get a sense of what is the feedback you've been receiving, CDEMA more specifically, has been receiving from those countries that promise to accept those persons affected in St. Vincent and the Grenadines?
Yeah, thank you very much for the question. The arrangements with respect to the reception of persons who are displaced have been handled at a high level on a bilateral basis. We have been supporting those states which have given those indications through technical advice. We have been working through with them some of the details related to, for example, mechanisms for registration, looking at matters related to the COVID protocols that would apply, and also how to manage the persons once they come into the geographical space, because of course, the principle of do no harm will apply. We don't want to expose either group, whether the home population or the persons who are displaced, to any elevated levels of risk. So these are some of the areas that we've been talking through with our states, and those conversations have been going on since late yesterday evening into today.
Just a quick follow-up to that. Can we say that, or is it a case that people have not been transported as yet from St. Vincent to the neighboring territories?
To my knowledge, there's been no movement of the displaced persons as yet. As I was mentioning, and I believe the Honorable Prime Minister Gonzalez in his press statements yesterday, he did reiterate the requirements which would govern those movements, particularly related to COVID-19 and the need for PCR tests, as you know, which is a requirement for any movement across geographical borders. And there's also been examination of the matter of vaccination as well. So these are processes that would need to be gone through in country. And I think you can appreciate that given what has happened today, there would be some arrangements that would need to be put in place. So at this time, our understanding is no, persons have not been moved as yet.
Well, this is the body. I just want to ask a question. Just a quick follow-up to that. Is there any time frame that CDEMA or these territories are looking at to realistically move persons across the borders? And an additional question to that. CDEMA has, well, it is being said that the region was aware that the likelihood of a full-on eruption from the volcano was imminent, and not much was done from CDEMA and these other agencies. How would you address that criticism?
Okay, thank you. So on the first question, to indicate that the decision on the timing of movements of nationals would be very much a decision within the remit of the government of St. Vincent and the Grenadines. These are their citizens, and they will make the decisions in the best interest and timing of their citizens. With respect to the second statement that you made, I reviewed the scope of the work that we've done since December the 29th. A lot of the work we do is really behind the scenes, and preparedness actions are, I suppose, not those kinds of things which attract a lot of media attention. So as you're working through the details of plans and protocols and going through the exercises, it doesn't necessarily attract a lot of media attention. But certainly we saw over yesterday and today the value of the planning. So the arrangements for the logistics and transport movements, for example, those kicked in. I had mentioned the West Coast settlements of Chateaubelair and Fitzhughes, and a big part of that planning was related to some of the constraints on the land side related to the access road into those communities. And it is really through the planning that we had made specific decisions on the utilization of marine assets, for example, to augment the land evacuation efforts, and that worked quite well yesterday. So as I said, a lot of the things are not immediately visible. Right now, you will see a bit more visibility in terms of the personnel on the ground and the movement of the relief items in, etc. And I really want to give kudos to not just the coordinating unit team, but also the team in St. Vincent and the Grenadines, because you can appreciate with the COVID-19 situation, we were a little bit constrained in terms of being able to get into country in the way that we normally would have supported the state. And we went through a process of utilizing remote options, and we ran exercises remotely with persons in country, you know, to sharpen up the plan, see where things may have fallen short. So a lot has been happening over the time, and I really want to thank you for that. And in addition, we've also been doing frequent posts on the social media sites of the agency. And certainly I would invite Andrea, if you can, Andrea, just to drop the social media handles into the chat as well. We post frequently there on all the activities, even the non-exciting ones like the work on plans. So you can get a lot of further information there. Thank you, Andrea.
Are there any more questions? If there are no more questions, I would like to thank Ms. Riley for that very comprehensive update. And I would like to thank you all too for joining and for your patience for our delayed start. And we will keep you posted as more information comes in. You have our Facebook handle. And if you've received my email, you know how to contact us for more information. So with that, I want to thank you for your time again and to wish you a good afternoon.
Thank you also. Have a good afternoon.